Let's see, who are we going to try next?
Not hearing from Daniel.
Why doesn't it occur to him that their system isn't working?
Helen Cisneros. Helen, if you are available for public comment at this time, please feel free to unmute your line.
We don't have an unmute button. See?
Not hearing from Helen. Let me move on to Umar, and apologies in advance. Tijani, at this time, please feel free to unmute yourself.
Is this intentional?
Not hearing from Umar. I will move on to William Aiken, apologies. William, if you are available for public comment at this time, please feel free to unmute yourself. Not hearing from William, I will move on to Shelley. Apologies.
This is just abominable. We've been doing this for 15 minutes now. There is no unmute button.
Beth Larson Steckler.
Come on, Beth. Get on.
Beth, if you are available
for public comment, please feel free to unmute your line at this time.
So we're 15 minutes into this now.
Hearing from Beth, I will move on to Gloria Ulrich. Gloria, if you are available for public comment at this time, please feel free to unmute yourself. Not hearing from Gloria, I will move on to Mary. Oh, and apologies again in advance. Veriniatis, IOTIS. If you are available for public comment at this time.
Look at this. This has been going on for 20 minutes now.
Not hearing from Dina, I will move on.
20 minutes in now.
Kimberly Collins. Kimberly, if you are available for public comment, please feel free to. Not hearing from Kimberly, I will move on.
I would like to take a moment to urge the members of this panel to please take seriously the issue of timely revision of the CDC guidelines for chronic pain. We have a catastrophe rolling out across the country in a wholly marginalized and invisible group. On top of that, we are losing workforce physicians at a steady rate. Everybody is in the gun sights of policy that is not working for anybody. I beg you to please make this an urgent priority. Thank you for the opportunity to comment.
Thank you, Terry. Thank you for sharing your thoughts.
Thank you very much. So my name is Becky. I have been a nurse for 21 years. I'm a mother, a friend, a wife, you know, all the things that normal people are. My questions are about pain management. So since 2016, we have all been put through the ringer if you're a chronic pain patient or even acute pain patients for broken bones, post-surgical, or just time doing damage to our bodies. So what I would really like to know is, where do you see pain management going, say, by the end of the year? Is the CDC trying to get rid of prescription pain relievers, and can we call them that instead of drugs? Also, when we're making differentiations between overdose deaths, I know my state in Tennessee recently released this, but the differentiation between illicit drugs and prescription drugs or pain relievers, like I said, because there's a staggering difference. Also, a lot of chronic pain patients are being forced to relieve their own pain, and by doing that, they are turning to suicide. And so when you see suicide rates or deaths increase, I have a very, very strong feeling that this is at least part of the reason why. Also, we would love to know, I'm with a couple of organizations, and we would love to know how to best navigate these waters to get us the medications we need to survive and have a quality of life.
Thank you, Becky. Thank you for your comments. And
weeds with chronic pain patients in particular, namely those that have intractable pain conditions, which means that they have pain 24/7. These patients are ill as a result of increasingly device-oriented surgical procedures that have injured these individuals and left them in pain. And the doctor abandonment that was caused by your 2016 guidelines that were written by physicians that are on this call, that are involved with the Physicians for Responsible Opiate Prescribing, have manipulated those guidelines with data that doesn't make any sense to our physicians. So as patients, we don't have the ability to have true, what we used to have in the United States, a true doctor-patient relationship, because DEA is in the middle of our doctor-patient relationship, as now are the guidelines that you all sent out, similar to the guidelines that you sent out for COVID-19 to wear a mask, except those guidelines were laid into law by insurance companies and were enforced by DEA to force doctors who treat our class of patients who are very ill and don't have a voice. No one will prescribe medication anymore. I implore you to look at the 90 milligram morphine equivalency that was written in your guidelines and find out what science they used to determine 90 morphine milligram equivalency. We all have very strong suspicions that they all want us on Suboxone, which is a medication that many of them who are on the task force for the opiate prescribing guidelines are stakeholders, and I implore you to look at this. Again, thank you for your service.
thank you, Angie. Next, I'd like to welcome Janice Garland. Janice, if you are available for public comment, I will give you the ability to unmute yourself, so please feel free to unmute yourself.
Hey, can you hear me?
Hi, yes, we can, Janice.
Hey, I became an EMT in 1982, paramedic in 85, and I'm presently an RN that's disabled from a work-related injury in 2010. With that said, pain management has gone back to the 80s, literally. And then with that said, I implore you to look into the research that was used for the CDC guideline. It was over 4,000 reports that were low-grade medical evidence that was gathered by about an associate. And that concerns me because there was a lot left out that could have benefited people in pain. And that, with that said, Andrew Kolodny and Jane Ballantyne were involved in the drafting of the guidelines. Both have recently admitted to conflicts of interest due to opioid litigation. There are several members through props that are profiting off opioid litigation. I find this highly unethical and disturbing on all levels in science. This is not the science that I encountered in 90 to 92 while going through RN school. We got to get back to the science of this. From what I understand, 90 MMEs was an empirical number made up by Andrew Kolodny. This needs to be also the Pain News Network.
30 seconds.
Pain News Network tried to get the CDC guideline minutes, and they released out of 1,200 pages, 95% of it had been redacted to the point of uselessness. I have submitted a request for those documents and plan to carry it to my elected peeps within the coming days. I would appreciate some integrity put back in this process.
Thank you, Janice. We appreciate your... Yes. Hi.
Yes.
Yes.
I think we have time for one more comment, and I know there are a number of people with hands still raised. please, we do want to hear from you, and Victor will again give you at the very end the email address to send in written comments. So just, well, this will be our last comment. Thank you, everybody, for your interest.
The floor is yours.
Good afternoon. I'm Richard Lawhern, PhD. I'm a patient advocate and healthcare writer with 25 years experience in the field, speaking on behalf of millions of pain patients whose lives have literally been destroyed by the 2016 CDC guidelines on prescription of opioid analgesics. I'm specifically concerned with the report of the BSC Opioid Working Group that was offered this morning, and I must apologize that I was unfortunately forced to step out during that item. So this comment is in addition to whatever may have proceeded from that discussion. I understand that CDC intends to broaden the scope of its 2016 guidelines to address acute as well as chronic pain. It appears that the December 2020 Comparative Outcomes Review 240 on treatments for acute pain from the U.S. Agency of Healthcare Research and Quality may become a major input to these revisions. I must assert with some regret that COR 240 is a fatally flawed document for many of the same reasons as the 2016 guidelines were. It reflects failures of scholarship, selective cherry picking of medical evidence to support a preordained political agenda, and grossly inappropriate methods of analysis. The acting director of AHRQ has refused to withdraw the report for an independent review team. Because of this, what I would regard as intransigence. Sorry?
30 seconds. Sorry.
I've filed formal complaint on grounds of fraud and abuse with the Congressional Committee on Government Oversight and Reform. I can be available for discussion of related issues with opioid work group members at your convenience. Please include these remarks in your meeting minutes, and thank you for letting me speak.
Thank you. Thank you so very much for your comment. At this time,